Welcome, everybody. It's great to see so many people and such strong interest. As I think most of you know, we are going to be doing a virtual Hill Day a week from today, following our annual policy summit, which will be happening on Wednesday next week. And as we were planning it, we were talking about how this is going to be a different year for us, that COVID has changed how legislative advocacy looks, and it's also changed the landscape for advocating around infectious diseases in general, in some good ways and some tricky ways. So we wanted to pull together both a refresher, because I see a bunch of experienced advocates in here, but also an orientation for anybody for whom this is going to be their first policy summit and Hill Day for hepatitis advocacy. And we're hoping to get more people than usual. One of the nice things about this moment is that on the one hand, we know that the political landscape has been dominated by COVID and certainly the impeachment that's happening right now and other really high priority issues. And so it can be difficult to cut through the noise and make sure that our issues and our communities and our voices are heard. On the other hand, the hill is essentially closed for visitors. So the ways that we would normally do this is that people who had some resources and connections would fly into DC in person and go physically meet with staff from their representatives, their senators. And now that we're in this virtual space, and that's opened up a lot more possibilities so that ideally our members of Congress and their staffers can be much more easily connected to people on the ground, grassroots advocates, patient advocates, provider advocates, and the communities that are most directly affected and have the most knowledge and the most to say about what the need really is. So we're going to walk people through what that looks like. We're going to talk a little bit about what we're asking for in terms of funding this year, a little bit about some of the key tips and strategies for being an effective advocate, some time for how to tell your story. We'll go through the agenda in just a minute. And then we also want to build in some time for people to get some practice experience, because it can be very daunting the first time that you're talking to a congressional staffer. And I think that was a lesson that I learned over a decade ago when I first started doing this, is that I feel like you've got to make the right impression. You've got to say all the right magic words that are somehow going to unlock support, that you've got to be completely polished and professional and all of that. And the thing that I learned after doing this for a while is that we actually serve as resources for them. That when you work for a member of Congress, you have to stay on top of so many different issues, so many different bills, so many different resolutions and budget line items and all that stuff. And that they really value people who can come in and say, listen, this is what's really happening. This is why the issue is important. This is why it's personal. This is why you can make an emotional connection to it. This is why it's going to stick in your head as something to talk about for your boss to champion. And I think that we've got some good stories to tell this year. We have a brand new National Viral Hepatitis Strategic Plan. That's a big deal because it's really putting us on the path to elimination, that we can imagine that over the next 10 years, with the right leadership, resources, coordination, that we could really eliminate hepatitis A, B, and C as a public health threat in the United States. It's a really strong, credible plan that's going to shape our message and our work and hopefully the funding for many years to come. We also know that viral hepatitis has come into focus in a new and different way as a consequence of the overdose crisis. The bad news is that that's meant that we've seen rates of hepatitis A, hepatitis B, hepatitis C, new infections going up. However, this is an issue that Congress has really grappled with and come to understand over the last few years. And there's a lot of members of Congress on the Hill who are primed to pay attention and sit up when you can connect your issue to something that they've been developing a record on because their constituents are demanding that they do something around it. And so we can put those pieces of the puzzle together. And then more broadly, we've seen how much COVID has set us back in terms of continuity of services, outreach, engagement, testing and vaccination programs, linkage to care, prevention. We feel this and we hear this when we talk to people in our communities and other communities. And that's a story that is going to be salient when we have this broader conversation as a nation and with Congress about what it really looks like to build and really rebuild a public health system that's capable of tackling COVID-19 and all the other infectious diseases like viral hepatitis that preceded it. So I think that we have a lot of important things that are going to resonate in a lot of key messages. And we're going to spend the time over the next couple of hours really hashing out how to do that in practice. So I'm grateful for all of you. I hope that I'll get to do some Hill visits virtually next week with many of you. And I will be cheering everybody on and turn it back to Michaela for some housekeeping before we plunge right into it. Thank you.
Thanks, Daniel, for the inspiration and getting us started. So welcome, everybody. For those of you who don't know me, my name is Michaela Jackson, and I am the Prevention Policy Manager at the Hepatitis B Foundation. And so thank you for spending your time with us in your evening or day with us. And so here's our agenda just laid out for you guys. I'm going to go through some brief housekeeping tips, and then we're going to move on to advocacy, talking about our specific asks and how we should conduct a virtual Hill visit, and just more of what Daniel talked about. So for housekeeping tips, we are, just so you guys know, we are recording this so that we can have it for posterity and that we can use this to help other people train in the future. And we will be using breakout rooms in the later half of the evening. So in order to use the breakout rooms, you're actually going to either need to log in through your phone on the app. You can't just call in, or you will need to be on your computer. And so the meeting ID and the passcode are on the screen, so you can take a screenshot, but it's also listed in the agenda I sent around earlier, as well as a few other places in your email. If you can't log in, just let somebody know, or shoot anybody an email, or shoot me an email, and we'll make sure that you are all set. And just a few tips. We ask that you guys please mute yourselves when you aren't speaking. We're all going to have a chance to speak later in the breakout rooms, and I'm really excited about that practice session, but just so we can move to the first part, that'll be great. So the mute button is on your bottom left. If you want to turn your video on and off, that's also on the bottom left. And if you need to message any of us, if there's a problem, or you want to message anybody else, the chat feature is specifically in the middle. And if you ever need to leave the meeting at any point in time, it's the bottom right. And now I'm going to turn it over to Rhea to speak on some advocacy tips for you all.
Thanks, Michaela, and hi, everyone. If you don't know me, I'm Rhea Racho, Program Manager for the Hepatitis B Foundation. I'm really excited that we have the opportunity for so many of you to participate in next week's Hill meetings virtually. So we hope this training will be useful for all of you. I do believe that there are some who are very experienced advocates, but we also have some newer advocates. So I'm just going to start us off with a quick overview of advocacy, why it's so important for us to have these meetings, and I'll also go through some key statistics around the current state of viral hepatitis in the US. The next slide. So why do we advocate? Sorry. Okay. My slide's on my screen. Okay, sorry. What is the point of all these meetings next week? So first of all, just to reiterate some of the points that Daniel made, members of Congress need to hear from you, their constituents, and the more directly they hear from you, the better. So our organizations can do advocacy in DC. We can advocate on behalf of communities impacted by viral hepatitis, but really the people with lived experience or organizations working on the ground who can report back on what's happening in the state or in their districts are the people that members need to be hearing from firsthand. So I know there may be individual constituents here, there may be people representing community-based organizations or local clinics, and those, any of those types of groups that are providing direct services are prioritized as well, in addition to individual constituents. And so much so that sometimes offices, when they're really busy, may not even accept meeting requests unless it involves constituents from their state or district. So again, the opportunity, even though we're sad that this isn't in person, we're also glad that this year we're able to bring in more of you, because you don't have to come to DC, but you can still be meeting directly with your members. So the next reason is that we need personal stories and anecdotes and examples from people experiencing the impact of viral hepatitis firsthand. We know that having stories paired with statistics and data will make our arguments that more compelling and memorable than just presenting them with our statistics. And I think you'll also find that when the time allows for it and you're able to have these more personal conversations with staff or with members themselves, you may be able to uncover some sort of connection with them that helps humanize the issue, make the conversation more personal, and open the door for more ongoing relationships. Just talking about your experience, even if they don't have something directly related to viral hepatitis, maybe they're better able to remember the impact of this issue because they themselves or someone in their family is impacted by chronic disease or cancer, or just have a similar story related to health access and health disparities. So so having people that can just speak about their personal stories, or having these community-based organizations that talk about their experience working directly with community is so important. And then the last point is that advocacy and policy change, we know, takes time. So you may feel like your meetings next week are, that the staffers are not really paying attention, or that it's just not going to make a big difference during this time when COVID is the focus. But, just remember that every meeting that we have, the more touch points we have, the more that we're able to follow up with regular communication and consistent messaging from a broad and diverse coalition. So from what you guys are doing next week, plus what national organizations can do when not everybody is in DC, all the follow-up, emails, calls, things like that will all add up and help showcase the support that's building for our issues. So even if you only have a few meetings next week, or if one of them is only 15 minutes, they're still so important, especially because you are the constituents and you are the people that they represent, speaking to them, and you're really bringing the points to life for them. So don't be discouraged. Just know that everything, the persistence, the messaging that's coordinated between all of us, and the follow-up will really help us develop our champions over time in Congress, or to strengthen relationships that we already have. Next slide. So just some quick notes about the timing of this all too. We are coming in at a really good time to meet with congressional offices. One, because we're still in the first couple of months of a new presidential administration. We have new members of Congress to educate. And right now, the start of the federal budget and appropriation cycle is underway. So I believe we're anticipating the release of the skinny budget from the Biden administration, a sort of initial preliminary look at their priorities within their budget request. We have the appropriations committees that are deciding how much funding will be allocated to specific agencies like CDC and NIH, and specific programs like viral hepatitis. We have those committees currently taking meetings and reviewing requests from all sorts of groups like ours right now to help prepare their list of items that they will support in their committees. So really every year around this time, it's appropriations advocacy season. So that's usual, but with COVID being the main focus right now, you might be asking yourself, is it really good timing? Like, how much attention will members of Congress really pay towards viral hepatitis? But again, we can't let that discourage us. It's COVID or no COVID. We know that Hep A, B, and C are impacting our communities, and the good thing is that with such a big focus on the pandemic, we actually have found opportunities to leverage because of the heightened awareness around what the current gaps are in public health infrastructure. We have people talking more about investing in infectious disease prevention and our capacity to respond to disease outbreaks. There's more momentum and discussion around improving immunization infrastructure. They're talking about access in general to vaccination, combating vaccine hesitancy. These are all things that in the long run will definitely benefit public health and our issues as well. So it's nice to have something to point to show kind of like to illustrate the issues that do currently exist with data collection and public health surveillance. What are the weaknesses that were highlighted that we're seeing with COVID right now? And how can we strengthen these systems to benefit future public health efforts overall? And well, last but not least, I didn't mention this one yet, but health disparities. I mean, we have the new administration having stated commitments to reducing health disparities and achieving health equity. And that really sets up our hepatitis talking points nicely, because we can point to the fact that addressing hepatitis, which has an overwhelmingly disparate impact on communities of color, is so important towards these goals of achieving health equity. Okay, so key stats. Before I go into the next slides, I did just want to note that you are going to get copies of the slides, and there's a recording, as Michaela mentioned, of this hour of the training. Plus, the graphs on the next slides are taken straight from the Hill Visit packets or the Leave Behind handouts that you will be receiving and using during your Hill meetings next week. So you'll have these in front of you later. You don't have to take crazy notes right now. And I'm just going to go through them pretty quickly too. So we have graphs on first hepatitis A, some key talking points or statistics that really we're trying to highlight to show the impact are starting with the top left, that there's been an increase in hepatitis A cases of 850% from 2014 to 2018. And you can see in the map right next to it which states have been most heavily impacted by these outbreaks. There's also a breakdown by age. We see the highest case numbers among 25 to 34, 35 to 44-year-olds. And then with hepatitis A, which is vaccine preventable, the statistics on vaccination coverage, which the bottom right graph shows that there really hasn't been a lot of progress in this, in increasing hepatitis A vaccination and ensuring using this tool that can prevent new cases. Next slide. So with hepatitis B, I'm actually going to start with the bottom left one that's looking at the chronic hepatitis B infection in the US. We know that there's an estimated up to 2.2 million people living with chronic hepatitis B, but only a fraction of those people are aware of their infection, and only around 10% are actually being linked to care and accessing treatment right now. And then going up to the top graph, so that's showing the estimated number of Hep B cases from 2006 to 2018. And there actually was a decline in cases for many years until around just within the last decade, seeing increases again. And tying that to the map there, in particular, where we're seeing rises in acute hepatitis B, parallels with areas of the country that are hardest hit by the opioid crisis. So that's important to highlight. And then the other graph on here, looking at vaccination coverage, this is a really a big one, a big issue, and a stat that I think surprises most of the staffers that we talk to, because this is among the adult population. Only 25% of adults in the US are vaccinated against hepatitis B, which I think, I think is a lot of people aren't aware of, because some people know that since 1991 that most infants and newborns are getting vaccinated for hepatitis B then, so they don't realize that there's this whole population of people born before that that are not protected, and only 25% have actually received the vaccine. So I think that that is a big highlight that we can talk about in an, we have this tool, and it's really frustrating to see increases in cases when hepatitis B is entirely preventable. And the last slide, hepatitis C. So huge increase. If you look at this one, that highlights over 400% increase just from 2010 to 2018. The care cascade on the bottom left also shows, I think it's unlike the Hep B graph, this one is showing 2 different years. So you can see there's slight improvements here, but not much. Over 4 million people living with hepatitis C, only around half aware of their status, and around 37% that are entering into treatment or have been cured. The cases by sex and age, the graph at the top right, you can see the high rates in the age groups of people in their 20s and 30s and baby boomers. And then again, I think this one is really striking, but the annual deaths from hepatitis C having surpassed all the other 60 nationally notifiable infectious diseases, that one I think can also surprise the staffers if you talk to them. So I know that was a lot, but on the next slide, there, again, you're going to get copies of this, but I also wanted to point out that there's additional documents that are being prepared and updated for you guys to have next week. A beautiful fact sheet that goes into the appropriations asks that Frank is about to talk about, an infographic talking about viral hepatitis and how services have been impacted during the pandemic. And but in addition to those documents, we also wanted to note that they do focus mostly on national, like a big picture overview. So to the extent possible that you can come prepared for your meetings with local data, state specific examples or incident rates, et cetera, that would be super helpful, because again, the members and their staff care about what's happening in their state and in their district. So we put HepVio as an example of a good website that does allow you to look up Hep C data by state. And if you need help finding other data for around Hep B or Hep A, you can always reach out to one of us, or maybe check your state health department websites or contacts that you have, or the most recent CDC surveillance reports. So yeah, all of that. And then you'll have the rest of the documents from us. So I think I am now passing it over to Frank. Thanks.
Thank you, Rhea. So my name is Frank Hood. I am the manager of hepatitis advocacy at the AIDS Institute, which is a really great job title to have, given that I was asked to talk about hepatitis advocacy tonight. If we could move to the next slide, please. So if anyone has ever done a advocacy training with me, you know that I like to start out with this quote or this definition, but it's important to me because I want to show that you are all already advocates, whether you've been doing it forever or you've just told one person on your Facebook something about hepatitis. You're an advocate because you're championing a cause and you're publicly supporting it. And you're really becoming an advocate now by moving forward and talking to your members of Congress. So Rhea laid out the current state of hepatitis, and as you can see, there are plenty of problems that need fixing. And so during my 10 minutes, I'm going to talk about how we can all discuss with Congress how we can all, as advocates, convince Congress that we have the best solution to some of these problems, because these are problems that are either living with firsthand or experiencing firsthand on the ground, promoting programs and operating with them. And we're also going to talk about some of the best practices to how to have a successful meeting. So we can move to the next slide, please. So the question is, what are we asking for? And right here we see two graphs talking about money. And yes, we are asking for money. But don't think about this request just being a stack of dollar bills, because it's actually so much more than that. Where we are asking this money to go is supporting very specific programs and will have a very specific outcome. And so think about these asks as, oh, I'm not asking for $100 million extra dollars, just whatever. I'm asking for $100 million extra dollars to specifically go into surveillance and training and testing. So as we talk about some of these specifics, just it's not a blank check. It actually is going to fund programming and ideas that either already exist and need to be expanded, or have shown to be successful elsewhere and need to be built into areas that are lacking those resources. So as viral hepatitis advocates, the two funding areas that we are most focused on currently are both within the CDC. One of them is the viral hepatitis core programs, that's over on the left-hand side. And after this last budget that passed in the last few months, there was a $500,000 increase, very modest. That was in fact the first increase we have seen to that funding line in several years. So that brought that funding line up to $39.5 million, which is a lot of money when we're talking about, like all of us hanging out today talking about hepatitis advocacy. But it's nowhere near what we need, and it's nowhere near what we're asking for. So the community ask is for nearly $95 million more, $94.5 million, to $134 million. And that seems like a potentially odd number, but that number was one that was created with conversations with the community, and it was conversations with CDC, and really looking at what money could CDC get out the door right away into states to do impactful things like surveillance and testing. And we'll talk about some of those specifics on the next slide, but just wanted to give a sense of like some of these increases. So that's that on the viral hepatitis side, where we're asking for $134 million. But when we look at how much is actually needed to put the US on a path towards eliminating viral hepatitis, when that question was asked 4 years ago and CDC put that number together, the answer was nearly $400 million a year. So 10 times the amount that they're currently funding, and we're only asking for an increase of about 3 times the amount. So it is a steep increase, but it is still like, it's still not the need. It's really just a starting point. And it really is because it's the money that can get out the door quickly. This other graph here on the right side is my favorite graph ever, because 3 years ago this week, this graph didn't exist. This graph exists now because of Hill visits and advocacy from hepatitis advocates. Actually, most of the ones on this page have done some sort of advocacy around that ask. This was an area that was identified really focusing on the intersection of infectious disease and having lack of sterile injection equipment. And so talking about that lack of sterile injection equipment as sort of a transmission source for infectious disease. And we see that lack of sterile injection equipment is responsible for HIV transmissions, other infective endocarditis, other things, but we especially see it in hepatitis. So when we set out as a community to have impactful advocacy around raising funding for that intersection of lack of sterile injection equipment and the transmission of hepatitis, this was sort of the end result. And it started as a conversation, a single conversation with one hepatitis advocate, their intern, and a Hill staffer, a half hour, actually about 3 years ago, I think this week. So it started there, and over the course of 8 months grew into something that passed both houses of Congress, that had broad bipartisan support, that had the infectious disease community behind it, and had the support of the Trump administration. So to give you an idea of how supported this idea was, and it has now resulted in really the only true increases in funding that we've seen on the hepatitis side in the time since then. So that first year it was funded at $5 million, then it got another $5 million increase, and this last year got an additional $3 million increase. So $13 million that didn't exist until hepatitis advocates stood up and said, hey, this is a need, and we should be very proud. And when we talk about the impact of these visits next week, this is something that could happen. It is not out of the realm of possibility. And regardless of whether it's a whole new piece of legislation, the conversations help drive an overall importance of getting this information out. For this, though, the new ask this year is increasing it by 107 million. And this is because the need has greatly increased in the last 3 years around infectious diseases and the opioid epidemic. So if we can move to the next slide. So there's a lot on this page. I'm not reading every word. This is actually going to go quick. So on the chart on the left, these are all related to viral hepatitis specifically. It is your surveillance. It is the money going to state health departments to do prevention, to do testing, to do some of it to do programs that support vaccination, to do education within the hard to reach and high risk communities, like going to homeless shelters or encampments, as well as working to help increase the number of harm reduction programs, because that is something that advocates have helped make possible in the last 5 years, 6 years, the ability to use federal funding for harm reduction. Over on the IDO side, sorry, the infectious disease and opioids, looking at, again, that addressing infectious disease vulnerabilities as it relates to lack of sterile injection equipment. And again, this is another set of funding that can support harm reduction. This looks at linkage in the sense of both infectious disease treatment and substance use treatment. The reason I said you don't have to worry too much about this is because if we go to the next slide, made it easy, used terms we can understand. The too long didn't read version of these are the core hepatitis programs aim to reduce the new cases of viral hepatitis through very disease specific interventions. And the infectious disease and opioid money focuses to reduce the number of cases where lack of sterile injection equipment is really the cause of transmission. And it's not just hepatitis, it's also HIV and some other things. It just has an outsized impact for hepatitis because lack of sterile injection equipment has an outsized impact on transmission. If we can move to the next slide. Okay, so I just talked about what our two numbers are that we are asking for and what it goes to support. And the reason why all of that is important, why that money is necessary to help fund those programs is because those programs go and support bending those curves that Rhea showed about cases going up. So everything that we're asking for money for is trying to fix the problems that Rhea pointed out in her slides. If we can move to the next slide, please. Which is kind of why tonight's training is set up like a Hill visit is. Your Hill visits are very much going to go the way that you've just seen this training go. You're going to kick off and say like, hi, I am. And then you're going to see where this person is that you're talking to is at in terms of their knowledge of hepatitis. Because the person you're talking to can be anywhere from a new college graduate who got a degree in health and is a legislative assistant who this is what their job is doing, or it could be someone like a chief of staff or legislative director who is 40s, 50s, 60s and not a new college student. Anywhere in between. You can have people who are the scheduler who have no idea about anything of your issue, but the person you needed to talk to couldn't do the meeting in that moment, and so this person's filling in. But you need to figure out where they are at their knowledge level. So you're gonna, the question you ask is like, how familiar are you with viral hepatitis? And you're gonna get a sense from there. And so if they understand it really well, you don't necessarily need to talk about it's a bloodborne illness, how it's transmitted. Maybe you can talk, kind of give the overarching Hep 101 on the stats instead of kind of diving into it. Because that education piece takes up a lot of your time. And so if you can get through some of it and get into some of the harder hitting details, or give yourself more time to give your story and how it relates to these pieces and these statistics and the current state of hepatitis, then that is going to be a more effective meeting than just reading off a piece of paper to say like, these are the case counts. You're going to do your ask in a couple different ways. One, you're going to mention your numbers that you're looking for a little bit earlier on, but you're going to give them the actual like, hey, can we count on your boss's support for this funding, at the end if they haven't given it already. So you'll talk about these numbers some, but like you will make a hard ask. We can move to the next slide, please. Oh, 11. Okay. So that was the flow of the Hill visit. And if you notice, it's just like a normal Hill visit, or not a normal Hill visit, just like a normal meeting, just like this training. It really is just a meeting. It is a conversation, but that is the flow. But how does this feel? And the feel is, I think, the thing that most people go in with a certain expectation about, that I think is usually the expectation that is like the most disconnected from reality. So like you're walking into your first hill visit, totally natural to feel some nerves, to expect it to be like a presentation and like you're in front of a panel of very important people who are like judging you and are going to like hold up signs to say 1 or 10. It's not like that. It is truly a conversation. And as Daniel mentioned, they really do see us as resources. They see us as experts in these areas. So don't walk in thinking like you don't belong, because that's not the case. So these are different pieces that I really just from doing this on a local all the way to a federal level, the pieces I like try to prep folks on. 1, be confident, because your personal story is more important than me as an expert talking head. I do really well talking about the stats, and I can weave a story, but that will only get us so far. You coming in and talking about how lack of testing has had a direct impact on you or your family or your friend or your community is going to, especially if you are in a community that is in this district that of the person we're talking with, that's going to go a lot farther. So you very much belong there. As I just mentioned, it's a conversation. It's not a test. They're not going to quiz you. But if they do quiz you, or if they have some questions they want to get some more information about, goes to the next piece about be humble. It's okay not to know. I have worked, 40 hours a week, sometimes more, oftentimes more, on the topic of hepatitis advocacy for nearly 5 years now, and there's still a lot I don't know. So it's okay not to know. Say that we'll get back to you. Just do make sure you follow up. I mentioned kind of the flow and order of a Hill visit. That being said, be flexible. Because it's a conversation, that conversations can go different places. Feel free to break from the agenda. Feel free to find different places to fit in your personal story, or even choose differently what your personal story is you're going to use for different points. Because you can have multiple personal stories. You can have a vaccination story, you can have a testing story, you can have a treatment story. They are all relevant and valid and have different places within the conversation. Also feel like in between meetings, check in with one another, see who's feeling comfortable about certain pieces, give each other feedback, but make sure it's constructive, and let's lift each other up, and let's talk about the good that we do with one another. Which actually, I guess, fits into be considerate. So these staffers do have many different meetings. They might come in late and still try to end your meeting on time. Just know that happens. So that being said, make sure to arrive on time and to stay focused during these, just so they can't walk away being like, well, these folks didn't take it seriously, so why should I? Like, it makes them have to be not interested themselves. Let's not give them a reason not to be. I've totally blown past my time by 4 minutes. Let's go to this last slide, and I can get us moved on to what is really like the key piece of this training, which is the telling your story. But luckily, you have the best telling your story person around to give it to you. So here are some Zoom best practices. Normally, these meetings take place in person, as was mentioned. I'll tell you right now that Zoom is not going to change these conversations at all. It is still the same meeting. In fact, I think they become better because we are able to have new and different voices in the room that we were not able to have. And I think Daniel kind of nailed it. Like, it's a privilege to fly in person to DC to do these. Like, it is a privileged thing. And so to be able to make this more accessible is a bit of a silver lining to a bad situation with COVID. So that being said, though, it is a digital meeting. We need to use some best practices. Video is the most effective, but please, the goal is for you to be comfortable and to deliver, put yourself in the best position to be successful to deliver your story. It is professional, so prepare accordingly and ahead of time. Here are some examples of different appropriate backgrounds. You see the one that I'm in currently. You can also use a virtual background. Over on the right-hand side, different things not to do, like let's pay attention. I'm wearing a hoodie and unkempt. There's a stack of dirty dishes. Fun, jokey, mean things are great on trivia night, but in professional meetings, not so much. Same with the icons. Just to take the time ahead of time to make sure your technology is working. Again, 5 minutes of trying to get your tech set up in the midst of a half-hour meeting is a lot. Look into the camera. I've been looking down at the slides, but it feels like it's kind of close. Do stay on mute when you're not talking. Very, very big one. You can kind of throw off the flow of your person. You could accidentally say something you don't intend. It could derail it really quickly with an accidental thing. And then last but not least, just you're in front of the camera and in front of a microphone. Just be mindful of what is in your shot and what you do in that time. Just don't want to put anyone into a situation that is uncomfortable or inappropriate. So apologies for going past my time there. I'm really sorry. I thought I was going to talk fast enough. I will move it over to Robin, who is a rock star, and I cannot wait to watch this training.
Thanks, Frank. Can y'all hear me okay? I'm guessing so. All righty. So hi, my name's Robin Lloyd Smith. If we haven't met, although it looks like I know a lot of you, I am a person who has been cured of Hep C. I work for Hepatitis C Association, run Help for Hep National Helpline, and also patient advocate advisor for National Hepatitis Roundtable. And I had a lot of tips, and luckily Rhea and Frank both covered quite a few things about the meeting. I'm talking about the story, how to tell your story, but a lot of that I was going to talk about how a meeting goes. They've given you a great framework, and we're going to have opportunity to practice. So I'm not going to take my full 10 minutes and try and get us a little bit back on schedule. There are some things I do want to be sure that we include, though. My first statement that I want to share with you is don't be nervous. It is a conversation, and the variety of people that you're going to run into over the years as you do Hill meetings, it's going to be really interesting to you, and you'll sit back and laugh at how nervous you might have been in the beginning. But really, these are people that we can help. I mean, we have asks, but there's a lot we can do to help them also. Having our story, you've probably seen in many ways how legislators use people's stories. It helps them to understand their constituents. It's important for them to know that a constituent is meeting with them. A lot of legislators won't even book a meeting unless there's a constituent with them. So they want to know the people that they're representing. So just, having a few tips, having this great information, doing some practicing, I think is all good stuff. Be yourself, be passionate, definitely let your passion show. Be honest and be appreciative of their times. So, in general, I would say, as we've already alluded to a couple of times, meetings can be of varying lengths. I've had 5-minute meetings in hallways, and 45-minute meetings where we really get into the nitty-gritty. You don't even know, if you have a specific time slot scheduled, that it's going to be that long. So I think when it comes to our story, it's good for us to have something that is brief and to the point, but very personal. 3 to 5 minutes for a personal story is a good target. If you have more time and you can go into more detail, that's great. A lot of times the person you're meeting with is going to have some more personal questions for you, and you answer them in whatever way you feel comfortable and feel best represents what you're trying to share. But that 3 to 5 minutes is a good guideline for crafting your story. If you get questions for more details, it is good to try and keep in mind that a couple of minutes in responding to a question is also a good guideline. But do think, and the more you do it, the more you'll come to think in terms of some sound bites, some things that it's going to be easy for them to remember about you, some things that it's going to be easy for them to quote that you shared with them as they're helping us work on this issue. Let's see. It's also good to depend upon your story, and how you use it is going to vary over time. You may end up having a couple of different ways that you present yourself depending upon what is happening. You may want to develop it for advocacy purposes. You might want to write it down. I know when I first started testifying, I would write down my testimony. I would read it to someone. I would record it. I would look at the time. These days, I've done that enough that I no longer write it down, but it was helpful at first to write it down and really see, you know, what is 3 minutes? What is 5 minutes? Because once we get to start talking, we aren't really paying attention to the time, and we shouldn't have to be. But it's nice if you have someone you can read it to, get their responses, have them read it to you so you can hear your words. Those are all good tips that can help you as you're developing your story. It is good to keep your language clear, concise. Don't use a lot of medical jargon, things that might slow the meeting down by you then having to explain something that wasn't really the point you were trying to make anyway. It is always important, and sometimes people forget this, but you know, when you're introducing yourself, do acknowledge the fact that you're a constituent for them. You don't have to tell them if you voted for them or not. That doesn't matter. That's the past. You are a constituent. They are representing you. Let them know that, yes, you need their help, but you're also willing to help them. You know, that maybe they'd like to have a town meeting on this and you'd be happy to participate. Things like that. You know, be thinking of ways that you can work together, collaborate to help your community and to help things we're trying to move forward. Let's see, I had all these things that are really there. And I think do think about the messages you want them to take away. Feel free to share the things that you're comfortable about with sharing about yourself. You don't have to get into a lot of details, but it is important that they know if you're someone that struggled with access, if you're someone that was not treated well, you know, if you couldn't get treatment because of Medicaid requirements in your state or your private insurance in your state, you know, those are things that it's important for your legislator to know. It's also important that you be aware of those things that are going on around you in your community as much as possible. But that's, you know, bottom line, keep it simple, but keep it personal. You know, just be you. They really appreciate when we come in and tell you these stories. You can tell, I mean, sometimes you're going to get someone young that you can see maybe they're thinking more about their golf score. But in general, these are people that really do want to pay attention. They want to hear you, and they want to know what can be done to help. And I think I'm going to stop there because we're going to do this, talk about these things more as we go into the practice sessions.
Thank you
So
so
thanks
much.
for being here.
Yeah, so thank you, Robin and Raya and Frank for that. I'm going to turn it over now to Emily to lead a quick Q&A session before we take a quick break and head into practice. So Emily?
Thanks, Michaela. Hi, everyone. I'm Emily McCluskey. I'm the Director of Policy and Legislative Affairs at NASTAD. We're so excited that you'll be joining us for this Hill visit. And I first want to do a special shout out to all of our presenters. That was really great. And I'm excited to do the Hill visit. So I hope all of you are as well. And I want to also thank Michaela, who put together this wonderful training, and we would not be here without her. So if you have questions, you can either put them in the chat or take yourself off mute. If you put them in the chat, I'll read them aloud for the speakers so that you don't have to worry about it. But if you prefer, you should also be able to take yourself off mute and ask one of the speakers a question. Well, I mean, I know the speakers were great, so they might have answered all of your questions already. There will also be an opportunity to do in our breakouts. You can definitely ask more questions if you don't want to ask them right now. Lauren just asked that if we're going to be showing the data slides during the meeting. We'll have the data slides in the Hill Visit packets, which will be virtual as well. So you'll be receiving them, all the materials via email. So you will have those accessible to you.
This is Richard. I just have a couple questions. One, I know that usually when you are doing Hill visits and you're well prepared, you hand them the packet of kind of like the big numbers and facts too, which allows them to not only have it on hand after, but to, if they do want to quote some of that data, they can be sure that they're not misremembering something that a constituent said. So I'm assuming that are we sending an email that is going to have those to the legislative staffers?
So we have scheduled a bunch of meetings, and we've also included calendar holds. So we'll be attaching those to the calendar holds, and then also following up with them in a thank you email.
Great. And then my second question is, and excuse me if I've missed some description of this, but for those of us who are not actual patients or family members of patients, are we trying to be paired with patients and then do teams like that? And then in that case, are we going to be practicing with those folks or trying to reach out ahead of time?
So we're doing these mostly by state. So some of the groups will have patients, it'll be an interesting mix, and there will be an opportunity for people to talk within their groups the day that the Hill visits start.
Great.
I want to add real quick to that, and because this is something I actually meant to include in my talk, is that I'm not assuming that everyone I was just speaking to is someone with lived experience with hepatitis B or C. If you're working with the community, your story is very important also. You know, your experiences, the things that you worked. I mean, it's like if I'm in a meeting, I talk about my own story, but I frequently bring up things that are happening with people that I work with through the helpline or through different advocacy groups. So, you know, what you're living through and those experiences with those people is also a very important piece of what we need to convey.
Thank you, Robin. Any other questions?
Well, I'll say, and that includes providers too. I'm not sure if we have providers on here, but we're going to have providers in some of the meetings, and they need to share how this has impacted them. And also the joy that they get when they're able to cure people. And also we need to share if we're someone that's been cured or been able to get the care we have, or been able to, you know, get a complete access to the care we need as people with Hep B. We need to share how that's enhanced our lives, how that's improved our lives. That's just as important as sharing the challenges.
This is Richard. One final thing. Has anyone had, who's done this, is there like an ending statement that is often the most powerful? Should we end recircling on a particular statistic? In our Hep B work, we always come back to the 1 in 12, or that 2/3 of people don't know that they're infected. Obviously, if you're a patient advocate, probably circling back on your own story, or just as Robin said. But yeah, I was just curious if there's like, you know, some good taglines or some unity thing that we should all be saying at the end. So if the staffers talk to each other, they're like, oh yeah, I had this meeting with, and then they all have, you know, the way that in some movements they have hashtag whatever at the end. Obviously that wouldn't really work in this case, but I'm just curious if we want to try to do anything like that. I know personalized stories from their own districts is the key, but just curious.
I think that's a great question, Richard. And maybe the planning committee needs to sort of put our head together and come up with sort of something that, even if it's just like fund hepatitis, or, I think this is the first fiscal year that we've had the federal government actually call for the elimination of the hepatitis epidemics. And maybe it is that of like, you need to work to eliminate these epidemics as public health threats in America, but shorter and nicer.
Right. I think actually, I think globally the Find a Missing Million hashtag was for that global. I mean, that is a great tag, and like anybody can be like, oh, well, missing million of who's a missing million is like, makes you want to figure out what that is. If we could have some national one, and again, this is planning, but then every Hep B and probably Hep C org, if we wanted to unite against the two viral hepatitises, could constantly have that and unite around something that everyone can Google.
Yeah, we'll have to work on that, Emily. I like what you were saying. I mean, something as simple as together we can eliminate viral hepatitis in the United States. That speaks to all of us working together. That could be a good way to wrap it up.
Yes, and Rick just suggested there's always end the epidemics, right? Yeah, so stay tuned for a possible update on Wednesday of a good little hashtag.
I have a question.
Yes.
Usually if we have a visit, we have a card or we get something or we leave contact information for follow-up. Will that be included in the package that's emailed to the people we're meeting with?
Yes.
Who the people are, where they're from, and their contact info?
Absolutely. So for everyone who registered for the visits, they provided their contact information. So we'll be following up with those visits. And we'll also be providing the contact information for who you met with to the people who are participating so that they have that, so they're able to reach out as well. I am gonna turn it back over to Adrienne.
Thanks, Emily. Hi, everyone. This is Adrienne. I'm the Director of Programs with NVHR. We are now going to take a quick break, but before we do that, I just wanted to explain a little bit about how the second hour will go. And so the second hour is really reserved for us to be able to practice our Hill visits. So you'll have a facilitator in each breakout room who will lead you through a mock legislative visit. So they'll teach you more about what that looks like once you get in your breakout rooms. But that is what's coming up next. There will be some time at the end to come back and ask any lingering questions. We will spend about 35 minutes in your breakout room, and then we'll return to this main session at 7:45 Eastern time. So for now, we'd like to give everyone a short break, time to grab a drink, grab a snack, use the restroom. So if everyone could please return at 5 after the hour, we will then sort everyone randomly into breakout rooms, and then we'll all reconvene in this main session at the very end, about 45 minutes after the hour, to answer any last questions. So thank you all for being with us tonight. Again, we'll take a short break. Please return at 5 after the hour, and we will get everyone sorted into breakout rooms at that time. Thank you.
Hey, Adrienne, it's Rachel McLean. I'm sorry, I had another meeting, so I just joined.
Hey, Rachel.
How's it going?
Good, how are you?
Good. Yeah, I'm gonna do that annoying thing and ask you what I missed. I guess I'm just a little curious about how Hill visits work virtually, because I've done them in person, obviously, but.
Yeah, absolutely. So we recorded the training, so we will get that link sent out to everyone if you happen to miss it, so you'll get that. But in terms of how things will go next Thursday, you'll be getting an email in the next couple of days with your schedule for next Thursday. And certainly, you can join as your schedule allows, but you'll be put into groups based on your state. And then you can join those Hill visits whenever you're able to, but you'll receive more communication with the schedule as well as any resources that you'll need for the actual Hill visits in the coming days.
Perfect. Okay. So what's happening right now? There's breakout rooms or something?
Yeah, so we just finished up an hour of training. So we did an advocacy overview, some background on appropriations and navigating virtual Hill visits. And then Robin gave a great presentation about telling your story for people with lived experience or for provider advocates or community advocates. And so now we are taking a 5-minute break. And when folks come back from that break, we will split everyone into random breakout rooms. And there will be a facilitator in each group who leads you through a mock legislative visit. And then we'll reconvene at 1/4 till the hour to answer any last questions.
Perfect. And thank you for I'm like showing up late to class. But
you're fine. I know you're busy. You're totally
about like the cost effectiveness of hepatitis treatment and how it really does prevent liver cancer and all these other things. And as Frank so lovely he pointed out, like cost effectiveness and deficit reduction are going to be hot topics this year. So it is always important to have those kind of things. And I think it is that is just talking about their constituents is another way to bring it home for them. And it might be a little bit more businessy, but it's also a really important point. It's something they do need to be reminded of. It's not something they can blow off.
And that really kind of fits in with the flexible side. I've had a few meetings that have been very like business, money saving driven focused, but overall it's been more patient focused or a little bit of a balance. But even on the kind of money side, there's still really, really smart public health arguments to be made that around the cost side as well, just around like treatment will result in less liver failure and cancer, but also things like, you know, less rheumatoid arthritis or renal failure or some of the other multimorbidities that we see with it. So there's still a way to connect what we're already talking about, which is hepatitis C has an impact on patients, and just say the exact same thing, but talk about the kind of the money piece, like this to this to this to this also has money with it. And so you just, when you say these pieces,
you can
also
roll that
say
in.
yeah. So it really is just like, it's kind of just picking off of a tree of the different arguments based on what that conversation is, because it is a conversation and because flexibility is kind of key to that conversation.
And those, do we have some of that, those data points in our packet that will be available? Or is that stuff we need to look up, like cost effectiveness and?
There is some data in it, but there's not a specific fact sheet on it, but we will follow up with them when that fact sheet.
Yeah, that would be great. Just something like, even if I know Robin was talking, it's like a liver transplant costs this, like a vaccine costs this, like then just extrapolation. Or, I mean, it would be awesome if we said nationally hepatitis B or viral hepatitis cost the nation this much, whereas a national vaccination campaign would cost this much. I mean, maybe some stuff like that exists.
So there is, I don't know, it's weird. Like my intern literally just found that exact article for the Hep C side. So I don't know this number on B. For C, from a study done in 2019, there was, oh no, this was earlier than that, but it was looking at the lifetime average cost for Hep C being over 200,000. And that was just for Hep C. Oh, I was like, Rick's got his hand up. Yeah, go for it.
Hey, so I'm a liver transplant patient and I've been on 6 treatments. My bill to insurance total is over $6 million. And that's usually what I lead with because it usually catches most people's ears. The thing is, my liver transplant in total, and I went to the most expensive hospital in California, Scripps, and it costs about $1 million plus. And that's pretty much because it's the operation and it's the maintenance as well. And the thing is, it's not just that maintenance, because you also have to talk about the social worker and all the other components that come into play. And those costs aren't always even across the board too. So those can be really costly in some states and less in others. But yeah, no, my total cost is about $6 million. So that number kind of makes sense to me, just on what I've seen too. But yeah, no, my costs are pretty ridiculous.
Thanks for sharing that, Rick. That's really helpful.
And then my second question is, we talked a little bit about what if someone says, okay, this all sounds great, but it looks like you're asking for, an increase from 30 to 130. That's like a huge jump. That's realistically not going to happen. What else can you throw out there? And since we obviously aren't trained negotiators or people from the national group, we are wondering if there's a good way to answer that, or is there a second tier that we're looking for? And then also, one of the ways that we've worked on trying to, because when you see, as a staffer, you see the 30 to 140 and you're like, wow, that is a lot. But we used to in Hep B say, if we could take, X amount from the budget from something else and apply it here, that would be decreasing that budget by 1%, and it would instantly give us 6 times this amount. And so I'm wondering if there's an easy one is saying a jet costs $1 million. This is a quarter of one military jet or something, some way that makes the person who's sitting across go, oh my God, this is, in the big scheme of things, this is nothing. Why aren't we giving more money to this? And so I think something that brings it into very big clarity like that on the numbers would be maybe helpful without alienating, you obviously wouldn't want to alienate a legislator who's on the military budget committee or something.
That is perfect question. And actually one of the documents that you will have in your packets will be a kind of extended version of the slide that showed the bars about where that money is to what we are asking. For the one that is the core funding around surveillance, that slide has a third bar, which is the president's money, but president hasn't given his budget out yet. So the fourth bar is what the actual need is, which is that $396 million. And so it shows that, like, yes, it is an increase, but it's an increase because it's been so underfunded for so many years. As for what is the like backup ask, the backup ask is whatever the money is that they are able to give. And that sounds like a kind of a cop-out answer, but it's more of a like how business and appropriations operates on the Hill. It's that sense of like, this is the need, this is really important, and we do our best to sell that number, but we're also not going to like, to not accept 5 million if that's all that's willing to offer, because that 5 million is better than zero. And so we just continue to work up. But the fact of the matter is we need to be advocating for impactful amounts of money. And so that is why we're advocating for the big amounts of money, because big amounts of money is what's actually needed. It's not a pie in the sky ask. The ask is actually probably low. The need is true. We just have to convince them it's true. And that's been the tough part. So you're going to do it for us, and it's going to be perfect.
I also think there's always this snarky part of me that's like, it's not my job to figure out how to pay for it, it's yours. Do not say that. You can think it, don't say it. But I would also just say, I think like COVID has taught us a lot about the need for investing in public health infrastructure. And I think bringing that up is really important. Like especially the COVID vaccine rollout, like has taught us like, we need to really invest in public health. And I think the hepatitis public health infrastructure is really the kind of the perfect model. Like if that had been built up, like we would have better surveillance, we'd have better vaccine like capacity than we do right now. We'd have like that structure. So I also think emphasizing that and sort of showing like the reason that we're investing billions of dollars right now into COVID is because we didn't have that. We didn't do these sort of like smaller investments every year.
And to that exact same point, the infrastructure that did exist that people tapped into for COVID was the sexual health piece that we see coming out of kind of the same center for CDC. And so it's things that had the infrastructure previously existed would have been able to be used for this outbreak instead of trying to play catch up now with both our outbreak and this other pandemic.
And you can also, just if you're going to be mentioning COVID, COVID has severely impacted hepatitis services in the US. And I'm sure you guys have seen the data that some of our organizations have pulled together. And it's pretty significant. So if we're not addressing that means this is a problem. Viral hepatitis right now, it's going to end up being another problem, an even bigger problem in the long run, even though it's still a problem now, but it's just going to continue to grow and grow if we're not working with implementation and the structures that we're already building now for COVID. We need to make sure we're incorporating viral hepatitis and any other diseases as well.
So I think Rachel brought up a good question that's kind of related to like backup asks. So what if the staffer can't support or wants to know about funding or non-funding related asks that they can help you with? And so we're like, will the materials have some sort of inclusion of other policy related legislation bills that we can mention if they're just like not interested in supporting funding asks?
Yeah, specifically, I was wondering, like, is there like a sort of, shared policy platform in terms of like the federal ban on funding for syringes and like, I mean, I always have like a long list of federal things, but like just the other day, I looked on the Medicare website and it still says that Hep C screening is only covered for people who inject drugs and baby boomers. Like it doesn't even cover the 18 to 79. Like they need a national coverage determination, but it's like, that's like super in the weeds policy stuff that only like nerds will know. And so, yeah.
So definitely. So I think we are right at the beginning of this Congress. So a lot of our traditional legislation that we'd also be talking about hasn't been introduced yet. But you brought up something great, which is the syringe service ban, and that is a good old cost of free. They can just do it and it will make everyone's lives better. So for those of you who don't know, that is to lift the federal ban on funding specifically for syringes in syringe service programs. We also are relaunching our hepatitis caucus. So if people are they're really interested in learning more, you can tell them that the hepatitis caucus will be calling for new members in the coming weeks, and we'll make sure that we send that out to all the offices that we meet with as well. And that's a way for them to sort of come together as advocates in Congress, but also to learn more and sort of become our champions.
I'm glad you mentioned that, because I was going to ask about that. Is there going to be a Senate and House, two separate ones?
So the Senate doesn't usually have caucuses because they are like just so much smaller. I mean, it's kind of, so typically the House does it. Sometimes they'll have Senate members of the House caucus, but they typically don't have a separate Senate one.
Okay, I couldn't remember, because I know we've always asked them to join the House membership.
And like sometimes some senators will cross over, but they don't usually have like a separate Senate caucus.
So just to be cognizant of time and everybody's time, and thank you for joining us all today, and Rick on his birthday for being here with us. It is 8
It's a
p.m.
great place to be.
It is
The
$8
$6
I
million
forgot to ask my
man.
question too.
Happy birthday, dear Rick.
Thanks, Randy.
Happy birthday to you.
Thanks, Deb.
So are there any final questions? Also, you guys please feel free to email me or anybody else on this call who presented if you have any more questions.
I have one last question. I asked it earlier, but it was in our small group. How are we going to kind of, so how's the structure of kind of this workout? So I know we're having some Zoom calls and we're having some phone calls and whatnot. But do we have some sort of a chat medium or some sort of platform that we're using kind of in the interim, like our lobby, if you will? So that this way it's a place we're talking, gathering, maybe have some stuff on our disposal or something like that. Do we have anything of that nature?
A really good question. And it is something that also came up today in our small group of planning. So what the best way to do that will be. So we will have people hopefully solidly in groups throughout the day. So I think that the leader will probably be running like a Google document that people can have up next to their Zoom or whatever platform they're using, so that you can sort of like chat with each other and not have the staffers see.
Okay, I was just curious but I mean, a Google document isn't really, I mean, like this would be like a chat text platform, something that we can communicate on outside of it. That's what I'm trying to envision here. Is that, do we have anything of that? Because that's Google documents, just our resources.
Oh, I just meant like you could write notes back to each other in the Google Doc, but let me think about that and we'll try to come up with like the best way to do that.
We could set up a text chat group. This came up on ours too, about the pre-planning, how it's really good. I know that the assignments for meetings are going out beforehand, and they're going to include all the contact information of the people that are going to be in your meeting group. So we would really strongly encourage you to touch base beforehand and kind of work out, who wants to address what, do some pre-meeting organizing with your little group. That helps a lot.
Yeah, I think that'd be great. But I suggest this because I also have a potential solution. And I think Robin, Randy, Deb are kind of a little familiar just because I presented it with the help just for our happy hours. And I think Discord could work really well for this. I think it's a good platform that does it. And I think you can organize a lot of those resources while at the same time allowing for communication and acting as an interim lobby as well. It's obviously up to you guys whether you guys want to use this or not. But I did set up a temporary thing just to kind of show as an example. If you guys want to see it.
Yeah, that'd be awesome.
Yeah.
He owns stock in Discord, seriously.
It's just,
he just set it up in the last 5 minutes.
I hate Slack.
Threw it all together. No big deal.
He did.
Yeah.
In our small group.
Well, it's convenient that I just kind of adapted the kind of the playtest server we were using. And so I've just kind of adapted that because I was intending on making it a Hep C community anyway. So I'll just, I don't know if I can, oh, can I share screen? No. No, I cannot. Okay, never mind. Cool. I think I have to be like,
I made you a co-host.
Given permissions or something.
So you should be able to share screen with that.
Oh, okay.
I just, sorry.
Oh, I have to wait. It says I can't wait.
Oh,
perfect. All right, there we go. Cool. I will add this right here. Screen 2. That seems good. Okay, so this is kind of the basic format for it. So what I've done here is, this isn't how you guys would see it. This is just the full thing. So the idea here is that this way you'd have your Hill groups that you could set up. You could actually assign them roles so that this way they'd be, you'd be automatically put into their group. So this way they would have their specific group, their specific strat set chat, and they would also have a voice chat that they could jump into if they wanted to have a voice chat in between sessions at any point in time. So it's just kind of a little bit of flexibility in the kind of group A. I imagine this would be like your different Zoom links or whatever. And if you want to have different resources, we can put in a whole resource channel as well, different things like that. Obviously you can see just the ones that I've put on here that were just here beforehand. But what do you guys think of it?
Oh, to be young with brains.
That's pretty cool.
Yeah.
I mean, I can jump in here. Rick, I mean, I'm familiar with Discord from gaming, obviously, but I think it's a great platform. I just got introduced more recently to Slack because I work at a small nonprofit and not a giant company. So, I mean, this could be just a conversation with me and you first, but I would like to figure out what's the pros and cons of Slack versus, I know you just said you hate Slack.
Oh, no.
Discord.
I am well versed in this because I've done this comparison now 4 times for 4 different industry groups. So the differences between them are, look, in terms of the user situation
interface,
Discord is easier for a new user to get started.
That's true. I agree.
And that's really the hurdle that I really am concerned about with this situation, just because Slack is unnecessarily complicated to start with. And that's really the only downside to Slack in the situation, because the integrations are fantastic. They're both free. They're both really easy to use. The threading system is a lot more easy to follow. There's a lot better DM structure systems that are in Slack. Cost-wise, they're basically the same, except for the fact that Discord scales better for having any sort of public interaction. That really the rundowns. We just did this maybe a month ago.
Discord, and I'm old, I'm 50, and I've been involved with Slack now for, I guess, 4 months with all the campaign stuff. So the Slack channel's been insane for me, and I understand it. There's a lot of emojis and a lot of stuff that goes on that doesn't need to go on. I'm also on your Discord, and the Discord was really simple for me, and I am a little tech challenged. So I would agree with either. If that
there's a lot of nonsense. There's a lot of nonsense emojis, she says, and then sends me a flower. So
I love you, Shells.
Yeah, I mean, ultimately, I think this is something a lot of our advocacy groups should be. I just suggested this in Hep B United the other day, like we should start a Slack. But man, Discord would be better for me because I already have that up and running in the background. But anyway.
It's also got a better profile, but I'll stop advocating for it so other people can have opinion.
I love the Discord.
I think really interesting. I think the small group is meeting again before Thursday. I can't remember what day today is. So if we can figure out a way to implement it, that'd be awesome. But I know time is happening. But I do want to be cognizant of time, since people might not have eaten dinner or anything before this. So who am I turning it over
to? Me. So I'm just closing this out. So you guys will be getting, just as a reminder, a packet with, not in person, but an email with all of the information and data that we discussed in the presentation. The presentation has also been recorded, so if you need to go back and listen to anybody say anything, there's also that option as well. And in the meantime, you guys can feel free to reach out to us if there is any questions or concerns about what's going on. But the actual policy summit where we'll be hearing from HHS and CDC and learning about the political landscape of the United States currently will be on Wednesday, the 17th, and the Hill visits will be on Thursday, the 18th. And with that, I will close this out. Thank you guys all for attending and spending your evening and day with us, and really appreciate it.
Yeah.
Have a great day, guys.
Thanks,
Thank you.
everyone.
Thank you guys. Thank you
Thanks,
very much.
everyone.
Bye.
Thank you. I'm sorry I was late.